Weaving knowledge and care. Implementation of an integrative outpatient clinic in primary health care training in Rio de Janeiro. Hello, my name is Mayra Machado. I am a family and community physician and a preceptor for the Family and Community Medicine Residency Program of the Municipal Health Department of Rio de Janeiro. Today, I will present the experience of creating a traditional, complementary, and integrative medicine outpatient clinic at a family health clinic located in the central area of Rio de Janeiro. The outpatient clinic was implemented in 2024 in a densely populated community marked by high social vulnerability. Since 2006, Brazil has had the national policy on integrative and complementary practices in health, but access to these practices is still unequal. The comprehensive proposal included my significant role as a dedicated preceptor. I possess a specialized qualification in traditional Chinese medicine from the esteemed Fluminense Federal University, and am officially certified as an experienced instructor for the National Acupuncture course specifically designed for primary care physicians, a program actively promoted by the Federal University of Santa Catarina and the Ministry of Health. From then on, a partnership was formally established between the multi-professional residency in family health and the family and community medicine residency. This service operated consistently once a week and served up to 3 individual users per shift. With shared anamnesis, clinical reasoning, development of an individualized therapeutic plan, and procedures in TCIM. The practices offered were acupuncture, auriculotherapy, moxibustion, and cupping therapy. PHC faces high demand for comprehensive care in chronic conditions. The conventional response is usually limited to medicalization, often without adequately considering the subjective and social dimensions of illness. Another significant challenge was the lack of structured spaces for effectively teaching TCIM practices. The effective solution implemented was to meticulously reserve the outpatient clinic exclusively for initial assessments and to collaboratively develop a comprehensive joint therapeutic plan with both patients and the dedicated team. Subsequent follow-up care was then the direct responsibility of the diligent residents during the family health team's own designated care shifts. As a preceptor, I consistently remained readily available to observe and thoroughly discuss the intricate cases, thereby ensuring both crucial autonomy and paramount safety. Although the outpatient clinic conducted only a limited number of 3 initial assessments per week, the overall impact and positive influence were demonstrably much greater. Each individual patient was carefully seen by the dedicated TCIM preceptor, working closely together with family medicine residents and also residents from the multidisciplinary team. From this initial comprehensive assessment, several subsequent follow-up appointments were then scheduled with medical residents in the family health teams, with experienced physiotherapists in chronic pain groups, and with qualified physical education professionals at the Carioca gym. In this effective way, 12 routine monthly assessments turned into dozens of subsequent and crucial appointments, significantly expanding comprehensive patient care and truly multiplying the valuable learning opportunities for the dedicated teams. The experience significantly strengthened clinical reasoning abilities, active listening skills, and a truly person-centered approach. Collaborative practice among family doctors and the multi-professional team enabled a more comprehensive therapeutic plan. Patients reported noticeable improvement in symptoms and a sense of being genuinely cared for. This experience brought valuable learning rooted in the reality of the territory and the concrete needs of the population. Based on this, a comprehensive training program for nurses was carefully created. In close partnership with the PICS management of SMSRJ, we strongly recommend the creation of similar outpatient clinics in other primary healthcare units. It is absolutely essential to ensure proper and thorough training, qualified supervision, seamless integration with the network, and robust institutional support. This valuable experience clearly proved the pedagogical and clinical value of TCM in primary healthcare PHC training. The integrative outpatient clinic model significantly strengthens collaborative practice, person-centered care, and paves the way for sustainability and comprehensive health education with TCIM. Thank you very much indeed for your kind consideration.